Right now in BC, we're in the midst of two public health emergencies. One is a global pandemic that, as of Friday, has claimed 196 lives in BC alone. The other is a widespread epidemic that has claimed over 5,000. Today, we're going to be talking about the first. As of Friday, August 14th, there are 629 active COVID-19 cases in BC, basically that we know about. Those are people who have gone and gotten tested. That is over 3 times the number of cases as when the public emergency was declared back in March. And yet the lack of restrictions has kind of stayed pretty much the same. Indoor dining is still happening at restaurants and schools are scheduled to reopen in September. So why is this? Well, there are a few reasons for this. It turns out that right now, most of the cases are concentrated in people in their 20s and 30s, young people. Now, young people are considered to be less at risk from the virus. You're less likely to die from it, although there have been people of all ages, including some very, very young people, who have died. And even if you don't die, you can actually get seriously messed up for a long, long time.
I'm a healthy 19-year-old guy who loves to play sports, and I still managed to get the virus.
It's really hard on the body, and you can have really long-lasting effects even when you're not sick anymore.
As I was in the hospital, my symptoms were still getting worse. I needed to be admitted into the intensive care unit, and it was by far the worst I've ever felt in my life.
Even though I'm not sick anymore today, I still have a problem with my breathing.
But even so, since young people do get sick from the virus less, that's why right now, even though we have 3 times as many cases, we're at about the same number of hospitalizations as we were back in March. But the more young people that get the virus, the more likely it is that it will spread beyond the current demographics back to people who are older and to people who are more at risk. Now, fortunately, there is more infrastructure in place to deal with coronavirus than we had back in March. For one thing, you'll notice that a lot of restaurants and places of business have put up those plexiglass shields. There are those little squares on the ground and so on, indicating where you're supposed to stand. So there's more infrastructure for physical distancing. Schools are, in theory, more prepared now for September than they were to continue education back in April. And there's a lot more testing happening right now. Back in March, it was a lot more difficult to get a test, but nowadays there are testing centers pretty much everywhere, and it is decently easy to get a test, although there are still major lineups. But one of the biggest things that the government is counting on right now to contain the virus is contact tracing. With contact tracing, when someone tests positive, trained health professionals can go through and interview them and then contact all of the various different people that person has been in contact with in the last few days. Then those other people can self-isolate or get tested. The government announced that they're hiring 500 new contact tracers for September. And right now, that's what the government is counting on, at least to make sure that we don't have to slide back to more strict lockdown conditions. Hey, it's Tuesday right now, and things have changed a lot over the weekend. Right now, there are now 775 active cases. The government has also announced that they are going to be taking some form of enforcement, trying to enforce social distancing policies. We don't know what those are going to look like yet, at least as far as I know. My guess is they're probably going to announce them on Thursday this week, so I guess we'll see what happens then. But people are still pretty nervous about the numbers. Last week, Premier John Horgan called on Vancouver celebrities Seth Rogen and Ryan Reynolds to give some sort of public announcement encouraging youth to stay home and stop partying.
I hope that young people in BC don't kill my mom, frankly, or David Suzuki, or each other.
This virus isn't over yet. It's not going to be over until we have a vaccine, which means that right now, the best you can do is not to pass judgment on photos of people on the Granville Strip or in nightclubs, but instead to model what you want to see in other people, what you know is necessary to slow the spread of this virus and to protect the people that we love. The BC Centre for Disease Control recommends that you keep a social group, the people that you meet up with physically, to only about 5 to 10 people outside of your immediate household. They also recommend that you only meet up with 6 or less people at a time, that you keep the windows open or meet outside if at all possible. Let people know that you're doing that. Do one of those Instagram chain stories or whatever. Actually, go to my Instagram story right now, take a screenshot of that, slap some @mentions of your friends on it, and send it out. And when you do go out, do maintain at least 2 meters or 6 feet of distance. And for God's sake, just wear a mask. We can do this, and we can prove to the news media that it's not young people that are a problem. It's always been the boomers. You know, those people who ask for Ryan Reynolds' help on social media. Hey, thank you so much for watching. If you found this useful or if you found it important, give it a share to a friend and give it a like. Let me know whether or not you liked it in the comments below or anything that you want to know more about. Oh, and if you want to know more about BC's current COVID-19 recommendations, you can visit the BC government's website at gov.bc.ca/COVID-19 or the BC CDC's website at bccdc.ca. Both are thoroughly engrossing reads. See you next week.